Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Pinworms are tiny, thin worms that can live in our intestines. Scientifically known as Enterobius vermicularis, these parasites are incredibly small, often measuring less than half an inch in length. Despite their size, they can cause significant discomfort and inconvenience. Don't worry, it's more common than you think. In fact, pinworm infections are one of the most common types of human intestinal worm infections worldwide. They affect millions of people every year, regardless of age, gender, or socioeconomic status. Millions of people, especially kids, get them. Children are particularly susceptible because they often come into close contact with each other and may not always practice the best hygiene. Schools and daycare centers are common places where pinworm infections can spread rapidly. They look like little pieces of white thread and can be a real pain, but the good news is they're treatable. These tiny worms can cause itching and discomfort, especially at night when the female pinworms lay their eggs around the anus. This can lead to restless sleep and irritability. Pinworms are easily spread through contact with infected people or surfaces. The eggs can survive on various surfaces, such as bedding, clothing, and even toys, for up to 2 weeks. This makes it easy for the infection to spread within households and communities. This is why it is super important to wash your hands. Regular hand washing with soap and water, especially before eating and after using the bathroom, can significantly reduce the risk of infection. It's also important to keep fingernails short and clean to prevent the eggs from getting trapped underneath. We'll talk more about keeping those pesky pinworms away later. Stay tuned for tips on how to prevent and treat pinworm infections effectively, ensuring a healthier and more comfortable life for you and your loved ones. How do you know if you have pinworms? The most common sign is itching around the bottom. This itch is often worse at night because the female worms lay their eggs then. You might even see the worms. They look like small white threads in your poop or on your underwear. If you see something like this, don't panic, just see your doctor. Diagnosing pinworms is pretty easy. Pinworms are tiny, white, thread-like worms that live in the intestines and can cause itching around the anus, especially at night. If you suspect you or your child has pinworms, it's important to see a doctor for a proper diagnosis. Your doctor might ask you to do a simple tape test. This test is straightforward and can be done at home. The doctor will provide you with clear instructions and the necessary materials, such as a piece of clear tape and a container to store the sample. You just press a piece of clear tape against the skin around your bottom first thing in the morning before showering or using the bathroom. This is because pinworms are most active at night and lay their eggs around the anus, making it the best time to collect a sample. The tape is then examined under a microscope for pinworm eggs. A laboratory technician will look for the tiny, oval-shaped eggs that are a clear sign of a pinworm infection. This process is quick and usually provides accurate results. This test might need to be done a few times to be sure. Sometimes, a single test may not capture enough eggs to confirm the diagnosis, so your doctor might recommend repeating the test over several days. Once diagnosed, treatment is simple and effective, usually involving medication to eliminate the pinworms. Section 4. Sending the worms, packing treatment and relief. Once pinworms are diagnosed, your doctor will give you medicine to get rid of them. The medication is usually taken in 2 doses, 2 weeks apart, to ensure that all the worms are eliminated. This is because the first dose kills the adult worms, but not the eggs. The second dose is necessary to kill any newly hatched worms before they can lay more eggs. It's important that everyone in your family gets treated, even if they don't have symptoms. Pinworms are highly contagious, and treating only the symptomatic person may not be enough to eradicate the infestation. By treating everyone, you reduce the risk of reinfection and ensure that the cycle is broken. Besides medicine, good hygiene is key. Pinworms spread through contact with contaminated surfaces, so maintaining cleanliness is crucial. Regularly washing your hands can significantly reduce the chances of spreading or contracting pinworms. This means washing your hands often with soap and water, especially after using the bathroom and before eating. Make sure to scrub all parts of your hands, including under the nails, for at least 20 seconds. It also means keeping your nails short and clean. Long nails can harbor pinworm eggs and make it easier for them to spread. Regularly trimming your nails and cleaning under them can help prevent reinfection and keep your family safe. Section 5. Keeping the wigglers away. Prevention is key. Preventing pinworms is all about good hygiene habits. Wash your hands. Make sure your kids do too. Keep your nails trimmed short and clean. Change your underwear and bedding regularly and wash them in hot water. These simple steps can go a long way in keeping those pesky pinworms away. UMCC, your ultimate medical consultant conquers.